Let's remember the facts. CO2 is accounting for more than 60%, 60 to 65% of the heating. Actually, over the last 20 years, the heating potential of CO2 in the atmosphere has contributed to 80% of the added heating potential. So CO2 is a major problem. Let's keep that in mind. It is the second biggest contributor, and actually its concentration has increased by 160% above pre-industrial time. Third one being nitrous oxide, also increasing quite significantly. These are the temperature annual since 1950. Over the last 65 years, things are increasing. Of course, there's a significant variability from year to year, and this can be influenced by things like El Niño in rain or La Niña. But a significant part of the increase in temperature is absorbed by the ocean sea level rise. The increase in sea level, you can see it's not flat because of winds, because of currents. Right now, the increase in the sea level on average globally is of the order of 3.2 millimeter per year. But in some places, and look at Manila, which is near the Redding, it's more than 1.2 centimeter per year. So it's 3 to 4 times faster than the global average. On the Philippines, it's about 35 centimeters higher than it was 60 years ago. And this has an impact, of course, on many ecosystems. It is a very significant thing on the food cycle as well. Many of you have experienced that in your own countries, an increase in the frequency of extreme events. Brown, you see the places with heat waves and or drought. Last year, there were very significant heat waves in South America, in the southern part of Africa, and in Australia. It was not only slightly above normal, it was truly exceptional. You have other places where you had cold waves, and the cold waves should not be taken as a sort of proof that climate is not warming. It is quite compatible with what we expect from climate change. An increase in the variability and the extreme. One of the big impacts, of course, is on the hydrological cycle. Many places which are suffering from water stress are likely to be even more affected by water stress, and vice versa. Countries can be very seriously affected by dramatic floods. Again, to look at the impact of extreme events, even if you look at decade left diagram, you see enormous variability from decade to decade. You see in the 70s, 80s, very, very significant droughts, particularly in Africa, which contributed to kill many people. But you have also flood, which is still killing many people. But what is increasing significantly with little variability is the economic impact. These are the facts. And these facts are based on an enormous number of observations, which are very carefully analyzed by independent centers. So this is very solid evidence. You cannot negotiate with the laws of physics. Lack of knowledge is no longer an excuse for not acting. We know enough to take action. We shall be accountable in 20, 30 years for the action that we have been either taking or the action that we are not taking now.
Thank you very much. I want to talk to these three headings that you can see on the slide. I talk just briefly about what we know about current impacts, a little bit about projections, and then lastly to touch on this terribly important topic of co-benefits. In terms of the impact of climate change, less than a degree of warming since pre-industrial times, we believe that the impacts are already visible in a number of areas shown in this diagram. The point of the diagram is to try and illustrate the size of the burden of disease, which is represented by the width of the wedges, and then the current impact, which is the number of rings that extend out across the diagram. This is one of these very striking examples of how climate change is already damaging human health. Of the heat wave that occurred in Russia in 2010, the probability of an event under a stationary climate is a factor of 5-fold different. And therefore, we've concluded that the Moscow heat wave is indeed attributable to climate change. Well, looking further ahead to think about what the consequences might be in mid-century and then end of the century, we're looking here at climate scenarios to warming possibly of around 4 degrees or so by the end of the century. As you can see, the risks, some of the issues that stand out are the health problems associated with undernutrition, heat, food and waterborne disease, such as cholera. The orange slices in the pie show what could be achieved inverting or reducing damage, applying best practice adaptations we currently understand. A great deal can be achieved, but looking out to the end of this century, and we don't believe that adaptation on its own will be sufficient to avoid health damage. This is an example of what's been called the hard limits on adaptation. What I'm showing is what we know about the relationship between temperature and working capacity. This is very well documented in the occupational health area, military medicine. As the temperature rises, the capacity to work diminishes because simply the body can't discharge the extra heat. But even under the best circumstances, as the temperatures rise, human activity is compromised and also health consequences. What we estimated was under the sort of medium-range scenarios in Southeast Asia, by the middle of the century, more than half afternoon work hours may be lost due to the need for rest breaks. Then if you go right out to the extreme right-hand end of our graph, above 10 degrees global warming, then large populated areas of the globe are simply uninhabitable. WHO has conducted a quantitative risk assessment of the effects of climate change on selected causes of death, looking out to the 2030s and to the 2050s. Again, nutrition stands out as the major risk. The risk assessment also looked at the question of where these effects may be experienced. Here we have a projection for heat-related mortality in the 2050s. The greatest effects are expected to be seen in Asia. These are the opportunities for early health gains if we make wise climate moves. I want to give you just two examples, one very local and one global. The local one refers to transport systems. In New Zealand, we look what we might achieve if we were able to shift from cars to bicycles. The answer is we could save an awful lot of fuel, we could bring about substantial health gains, and we could save a lot of money in health costs. The other example I wanted to give you is one that Dr. Steiner has referred to already. The exercise looked at just what we could achieve if we were able to reduce emissions of black carbon and methane compared with business as usual. There would be substantial benefits achieved in terms of climate change, human health, and food security. So just to sum up, there are substantial risks, not restricted to the issues of undernutrition, heat, fire, drought, and food and waterborne disease. Thirdly, opportunity. There are substantial health improvements that can accompany climate risk reduction, both in terms of mitigation. Think about the opportunities for health-promoting low-carbon diets, but also in other areas. The most important adaptation measures are to ensure that we have basic health infrastructure, health resources. Thank you.